Hi, today's lesson is on the basic chest CT, and we're also going to be discussing abdomen and pelvis CT too. So one of the first things that you want to do is set your room up, and it's going to look something like this. You have a sheet on the table, you have a pillow, and your patient's going to be going in feet first. So I have a little video here. I did have a video. Let's go back. I have a video here of Kristen, who very nicely volunteered to be my patient. We're going to show you how to set up for chest CT. I'm actually will go over an abdomen and pelvis CT too. Patient position is the same, feet first and supine. Now you want them flat. You can put something up underneath their knees if they're able to. Just get them to relax their knees down. Some elderly people and some people with back problems will be more comfortable if you put a little something up underneath their knees. And you want their arms up over their head and out of the way. Now, some elderly people are not going to be able to do this. One of the things that you can do is have them put their hands on the gantry and let their arms move with the gantry. Or if you have to, you can have them down by their side, but you want to try not to do that because it can lead to a lot of streak artifacts. Now we're going to move our patient in. Again, these are the two buttons that you're going to push to move your patient in. This makes the table move faster. We talked about what each button does in the last lesson, so I'm not going to go over that, but I just wanted to show you what a bird's eye view, what you would be looking at. Now you're going to move your patient in. You'll use these two buttons. And you can check and see that they're moving in. Then we're going to go back and turn our positioning light on. Remember, this is the axial positioning light that you use. Now, the first position I'm actually going to show you is for the abdomen and pelvis. I will go on up and show you where you set for the chest, but the mark for the abdomen and pelvis is actually going to be at the xiphoid tip. Now make sure when you go to feel for the xiphoid tip, you let your patient know, I'm going to be touching you. Tell them every step of the way, I'm going to be moving the table, I'm going to be touching you, so that they're not surprised. And this is kind of a personal area to be touching people at anyway, especially for women. So you feel for that xiphoid tip, and that's right where the axial positioning line is going to go for an abdomen and pelvis CT. Now for a chest CT, it's going to move on up, and it's going to go at the synovial notch. Your sagittal line will be at the mid-sagittal plane, and your coronal line is going to be at your mid-coronal plane. So now we've got that line moving up. Get a nice view of it going up and getting into position. Now, dressing the patient, you need to make sure that they don't have any jewelry on in that area, so you need to make sure they don't have any necklaces on, no piercings, anything metal that could be in the way of your scan. And there you go. That's what it looks like when you've got your patient correctly positioned in the gantry for a chest CT. Now here's another look at it. Again, the axial line is at the synovial notch, and the sagittal line is at the mid-sagittal plane. And if you remember, the coronal line is going to be at that mid-coronal plane. A lot of times, if you look at that seam that people have on their shirts, that's a good judge of what's going to be the mid-coronal plane. Now again, when you're sitting down at your control panel, this is your left-hand monitor, and we'll go through this again. You're going to click on New Patient. This screen will pop up. You're going to click on Patient Schedule, and this screen will pop up. You're going to choose your patient that you're going to be working on. Make sure you choose the right one. This screen will pop up, and then you're going to click on Today Routine Chest. That brings up this screen, which is your scout screen. Again, if you have any questions in positioning your patient, just look at this area, the top left-hand corner, and you'll see your anatomical reference is going to be synovial notch. Your patient orientation is going to be feet first, and your patient position is going to be supine. And here's your scouts that you're going to get, your lateral scout and your AP scout. And in order to get those scouts, you have to hit confirm. And then you'll look at your keyboard. You're going to move the patient into position with this button. And you're going to start your scan with this button. Now to view the images, you want it on abdomen. And you're going to use the move to scan and the start scan buttons for each scout. Once you have your scouts, this screen is going to pop up. This is your procedure screen. And again, you want to click on the Show Localizer button, and it will bring up your scouts for you to put the localizer in the area where you want it. Now for a chest, you want it to go just above the apices. You want it out as far as the soft tissue. You want it past the soft tissue on the sides. And you want it down to where you're going to get the adrenal glands, which lie on top of the kidneys. So you want to go about halfway through the kidneys. And to do that, a good judge of it is going down to the last rib. That's what it looks like on your AP, and here's what it looks like for your lateral. Again, you're going to hit that confirm button, and you're going to go back to your keyboard like you did before. Now sometimes you want to set a second recon. Most places now are asking for at least coronal views of the chest. So this is how to set your second recon. You're going to click on the body part. It's going to open up this screen. You're going to click on Show Recon 2 down the bottom right. That's the highlighted button. And over where the arrow is, under Recon Enabled, you're going to turn it on. Most of the time it's set for what they want you to do. This one is in order to do the coronal reformations. Here's your keyboard, your Move to Scan button, your Start Scan button, and again, you can view your images on abdomen. Now here is a cool chest CT I thought you might like to see. This was, I found this on YouTube. It shows the axial images, and if you look, you can see a little tumor in there, but then they put the axial images together on top of each other so you get a 3D image. This is what is so amazing about CT now and the things that you can do with the new 64 slice and more. So if you look, they've even highlighted that tumor with some color. So you can see exactly where it's located. It's great for tumor localization. It's just amazing what CT scan can do now.